Okay, for PSCCL, you'll have 15 minutes to review the chart by yourself before the instructor comes into the room. And then once the instructor comes into the room and you're going to review the chart with them, then you'll have 30 minutes to review with the instructor and then go and give your medications. So we're going to start like your instructor is here with you. And the first place we're going to go is the history and physical. When you first log on, you may not see this screen right up here, so just use this sidebar to go all the way up to the top. And you need to find the patient's name. So we have Jessie Wilson, female, her date of birth 6/9/42. She is a 74-year-old female, patient of Dr. Arrington. We need to tell the instructor that she's allergic to Bactrim. And then we're going to go down to the impression. And here's the impression. We're going to tell the instructor the diagnoses. So they're diagnosed with congestive heart failure, dyspnea, CAD, fever with cough, and SVT. Then we need to show the last set of vital signs. The vital signs, the pulse was 88, respirations were 18, temperature 99, blood pressure 140/84, oxygen saturation was 97%. We've already spent 15 minutes looking over the chart on our own, so we know the medications we're going to give and the labs that we need to look at. We're going to go to the chemistry over here on the sidebar. Because I'm going to be giving Lasix, I know that I need a potassium. Here's the potassium. It's 4.0, so I make myself a note. Potassium 4.0. And then I know that I'm going to be giving digoxin, and I need a dig level. The digoxin is 1.5, so I make myself a note to dig 1.5. Okay, so then we need to come back and show the physician's orders. Okay, and I need to focus in on the medications. So here on day 2, we're going to start digoxin 0.125 milligrams, 1 tablet PO daily. Change Lasix to 40 milligrams, 1 tablet PO daily, and start ciprofloxacin 500 milligrams, 2 tablets PO BID. And then I need to go to the MAR and compare and make sure we have the correct medications on there. So I just click on that medication record, administration record over there, and it pulls it up. And I have furosemide 40 milligrams PO, 1 tablet every AM at 0900. And so for that medication, I have to get the potassium level, and I've looked at that, it's 4.0. I need to get a blood pressure, and so I'll do that once I'm in the room. Then I move on to digoxin 0.125 milligrams PO, 1 tablet every AM. It's scheduled at 0900. For this medication, I need the dig level, which is 1.5. I need a blood pressure and an apical pulse, which I will get in the room. When you're doing your medications, you want to, and discussing them with the instructor, you have to give them the information off your drug card. So with the furosemide 40 milligrams, 1 tablet every AM, you give them the, you need the lab. So right now we're just checking the medication record. So dig 0.125 milligrams PO, 1 tablet every AM at 0900. Apical pulse and blood pressure will get in the room. Dig level is 1.5. Ciprofloxacin 500 milligrams PO, 2 tablets BID, 0900 and 2100. We don't have to go back to the physician's orders to compare again, but if you're more comfortable with it, you can go back to the physician's orders and read through one more time. But do remember that you are timed and you only have 30 minutes to get this whole process done. So at this time, we go to the medication room, and the first thing we're going to do is wash our hands. A good hand wash. Okay, and then we come over and grab our medication tray. We have room 105, Jessie Wilson, date of birth 6/9/42. You have to hold it up to eye level. Dr. Arrington, 579524. We're going to get the supply that we would need to give the medications, which is a souffle cup, put it in here in your tray. The water is already going to be in the room, so you don't need to get a water cup at this time. So we're going to go back to the computer. And at this time, we're going to do our first check. Okay? So we get our first medication. Just want to verify that you have the correct medication administration record since you walked away from the computer. So we want to go Jessie Wilson, female, date of birth 6/9/42, 6/9/42. Her medical record number is 579-524, medical record number 579-524, room 105, room 105. Okay, so we verified the patient's ID with the tray, and now we grab our first medication, which is furosemide, 40 milligrams PO, 1 tablet every AM. It's scheduled at 0900. I have a potassium. I know I need a potassium. It's 4.0. I need a blood pressure, which I'll get in the room. And right here I have furosemide, 40 milligrams. It expires 4/10/2019. Okay. So then I need to get my drug card and tell my instructor the generic name, brand name, classification, mechanism of action, 1 to 2 adverse effects. Okay. So I'm going to put that medication as my first check is done. Then I move to digoxin. So digoxin 0.125 milligrams PO, 1 tablet every AM, scheduled at 0900. I have digoxin 0.125 milligrams. It expires 10/22/2022. I need a dig level, which is 1.5, and I need a blood pressure and apical pulse, which I'll get in the room. You get your drug card. I tell the instructor the generic name, brand name, classification, mechanism of action, and 1 to 2 adverse effects. And then your first check is done with the digoxin. Then I'm going to move to the ciprofloxacin. So I have ciprofloxacin 500 milligrams PO, 2 tablets BID. I have Cipro 500 milligrams. It expires 12/9/2019. Cipro 500 milligrams expires 12/9/2019. It's 2 tablets, 500 milligrams, which equals the 1,000. It's scheduled at 0900 and 2100, and I'm responsible for the 0900 dose. And I go over my ciprofloxacin drug card, giving the generic name, brand name, classification, mechanism of action, 1 to 2 adverse effects. And so the first check is done. So you get your drug cards, get your supplies here, and then we're going to leave the med room and come to the patient's door. And I have, I'm going to compare my tray with the patient's door. So I have room 105, Jessie Wilson, date of birth 6/9/1942, date of birth 6/9/1942, medical record number 579-524, medical record number 579-524, Dr. Arrington. I knock on the door. Come in. Hello. Hello. My name's Jennifer Steffey. I'm a student vocational nurse. I'm going to be giving you your medications today. You set your tray away from the patient and come and wash your hands. Okay. I'm just going to double check the identification. So the first thing I'm going to do is pull up my medication record here in the room on the computer chart. Okay, making sure I show the patient information at the top of the page. Okay, Mrs. Wilson, I'm just going to verify your ID, okay? So I have Jessie Wilson, date of birth 6/9/42, date of birth 6/9/42, date of birth 6/9/42. She's a patient Dr. Arrington. medical record number is 579524, 579524, 579524. Can you tell me your name and date of birth, please?
Yes, Jesse Wilson.
And your date of birth?
It's June 9th, 1942.
Okay, and so that matches. And I show on your allergy band that you're allergic to Bactrim. On your chart it also shows that you're allergic to Bactrim. Are you allergic to any other medications, tape, iodine, shellfish, latex, or peanuts?
No, ma'am. Bactrim's the only thing I know that I'm allergic to.
Okay, so we verified the patient, verified the allergies. So the first place we need to go is right here under patient ID scan. Okay, and you click in that first box next to the furosemide. We're going to scan the armband. Okay. Now we know that we have to check vital signs for the medications, so I'm going to go ahead and set the patient up. I'm going to raise the head of your bed because you're going to be taking some pills, so I want you to be sitting upright so you don't choke, okay?
Okay, that's fine, dear.
All right, here we go. Set her head up. Is that okay?
Yes, ma'am, that feels about right.
Okay, I'm going to raise the bed up a little bit. And at this time I would check the blood pressure and check the apical pulse. And then I'm going to document those results on the computer charting. Okay, so for the furosemide I needed to get my potassium. So I'm going to type in K plus, and my potassium level was 4.0. And then my blood pressure, it was 120/80. So I'm going to type that in, and you just type it in under the 0900. I'm going to go ahead and enter in the information that I needed for the digoxin, which was the dig level was 1.5, and the apical pulse was 70. And the blood pressure, again, 120/80. Okay, so my MAR information is on there. Okay, and so now I'm ready to proceed with my second check. So I've already scanned the patient's armband. I'm going to click on under the medication scan box, and I'm ready to pull out my first medication here, which is the furosemide. I'm going to scan the container, scan the barcode. If you have trouble scanning, okay, this one did scan, but if you do have trouble, there's a number right under the barcode that you can enter in those that number right there, okay? So it's scanned, then I'm going to proceed to do my second check. Furosemide, 40 milligrams PO, 1 tablet every AM. I have furosemide, 40 milligrams. It expires 4/10/2019. It's to be given at 0900. I'm going to get my drug card, Lasix drug card, show the patient the medication, and say the medication name and the milligrams. So does this look like the furosemide 40 milligrams tablet that you take?
Yes.
Okay. And then we're going to tell the patient what they're taking it for, do a short patient teaching. Okay. And then, let me just turn around so you can see kind of on the camera here. Okay. First, before I open that, what I would suggest is to go ahead and get a glove. And that way, sometimes the pills stick to the packaging. And so if you'll just have a glove nearby and put it in your medication tray, if that does happen, then with the gloved hand you can get the pill and put it in the medication cup. With the furosemide, you want to open it downward, keeping your pill cup in the medication tray. Open it down, okay, and that did, no, it fell, okay. So now I have an empty container, and I'm going to do my third check here. Furosemide 40 milligrams PO, 1 tablet every AM. Furosemide 40 milligrams and expires 4/10/2019. This is my 0900 dose. Okay, so that's my third check. I need to check my patient's swallowing ability, so I'm going to give her a sip of water. Take a sip. Okay, so I note no difficulty swallowing. Alright, here's your Lasix. And here's your water. Okay, now can you open your mouth and say ah? Okay, and so I'm checking the patient's mouth to make sure that the medication was actually swallowed, and it did go down. She took that medication, and now I can document it. I come over here and I click under the initials next to the furosemide, and I put my initials there. Okay, now we're done with that medication, and we're ready to move on to the second one. I'm going to have to click in the patient ID scan box, scan the patient's armband again. Make sure you pull the tray close enough. Okay, and then I pull out my digoxin, scan the barcode on the digoxin. Oops. We need to click on the medication scan box, which is right under the patient ID scan. Scan the medication. Okay. And then do our second check. Digoxin 0.125 milligrams PO, 1 tablet every AM. I have digoxin 0.125 milligrams. It expires 10/22/2022. This is to be given at 0900. Dig level was within normal range. Vital signs were within normal range. Apical 70, blood pressure 120/80. I get my medication drug card for digoxin. I'm going to show the patient and teach. Does this look like your digoxin 0.125 milligram tablet that you take?
Yes.
Okay. This medication is for, you would tell the patient what they're taking it for, do a short patient teaching. And then you still have your medication souffle cup inside your medication tray. Open the digoxin downward. Okay, and that pill did stick to the inside label there, so I'm going to get my glove on. Take it my digoxin. Open it downward. That pill into the cup here. Now I have an empty container to do my third check with. Digoxin 0.125 milligrams PO, 1 tablet every AM, scheduled at 0900. I have digoxin 0.125 milligrams. It expires 10/22/2022. Okay. Once you've done one swallowing check, you don't have to check again, so she's just ready to get the medication. So here's your digoxin. Here's some water. Okay. Can you open your mouth, please? Okay, I can tell that the medication is gone. So she's taken that, so I can come over here and sign for the medication. Just put my little arrow in the initial box and then tap in my initials. Okay. And so now I'm ready to go on to our last medication, which is the ciprofloxacin. I make sure that my line is here under the patient ID scan box. Now scan your armband again. Okay, so it's scanned there. And then I need to click in the medication scan box next to the Cipro under the patient ID scan. And I get the ciprofloxacin tablets out. There are 2 of these. I have to scan each of these individually. And you can see this barcode's a little messed up, so I'm going to have to type in the number under the barcode. And it's 2000514. Okay. And I'm going to see if this will scan. Okay. that one did scan. Okay. So then I'm going to do my second check. Ciprofloxacin, 500 milligrams, 2 tablets, PO, BID. And I have ciprofloxacin, 500 milligrams, expires 12/9/2019. Cipro, 500 milligrams, expires 12/9/2019. I have 2 tablets of Cipro, which equals 1,000 milligrams. It's scheduled for 0900 and 2100. I'm only responsible for the 0900 dose. Okay. So now I'm going to get my, show the patient. Does this look like the Cipro 500 milligrams, 2 tablets that you've been taking?
Yes.
Okay. Grab my medication drug card for that. Okay, tell the patient it's the name of the medication, tell them what they're taking it for, a short teaching. And then I open the Cipro into the souffle cup over the medication tray. Okay, and I have my empty containers now, so I can do my third check. And I have ciprofloxacin, 500 milligrams, PO, 2 tablets, BID, scheduled for 0900 and 2100. I'm only scheduled for the 0900 dose. I have Cipro, 500 milligrams, expires 12/9/2019. Cipro, 500 milligrams, expires 12/9/2019. I have two tablets. It was 500 milligrams apiece, which equals 1,000 milligrams. So that was my third check. Here's your Cipro. Here's your water. Can you open your mouth? Okay. All right, so I see that she's actually swallowed the medications. So I have to come over here under, see the time 0900 right next to that under the initial column and type in my initials. So I'm just making sure that my initials are all in the right columns, medications have all been scanned, my MAR information is on the MAR. I'm going to go down to, scroll down. You can either scroll down here or there's the little scroller on the mouse. And you've got to go down to page, right here, page 7. You can see where it says page 7 right here at the bottom left. Put my name and initials. So, okay, there's my name and initials. I need to put Jennifer Steffey, SVN, Student Vocational Nurse, and then there's my initials, JS. Okay, so I clean up all of my supplies. Okay, we're done with your medications. Would you like your head laid down a little bit?
Let's lay it left back just a little.
Okay.
That's good, thank you.
All right, you're welcome. Make sure that the bed is in a low position. The side rails are up. Call line is within reach on the bed. The bed brakes are locked. Put my bedside table back here with our water within reach. Is there anything else that I can get for you right now?
I'm good, thank you so much.
Okay. Once we're done, you don't do anything else with the computer because the instructor will come in and just double check your documentation. So I'm going to wash my hands, do my second safety check, grab my med tray with all of my drug cards and anything else that I brought in the room, and then I'm ready to exit. Thank you. And so when I'm coming out, I'm going to go ahead and go into the med room, put away my medication tray, and dispose of my pill containers and my glove in the trash.